One of the structures that we study when we take up body regions would be osteology. Osteology studies or deals with bones. So the first anatomical region that we will take up is the back. So shown here are the vertebral bones. We have one bone taken from three of the vertebral segments. Uh, This one comes from the cervical segment, thoracic, and lumbar. The sacral vertebra will be shown and discussed later. So what we have here are the typical cervical, thoracic, and lumbar vertebral bones. Vertebral bones in general, they share common structures. So the common structures found in vertebral bones, no? Particularly the typical vertebral bones, regardless of their location. We have the spinous process, the lamina, uh, you have the laminae right there. Then we have the body, transverse process, and then the spaces or openings. We have the central canal for the spinal cord, right there, and the pedicles. The pedicles will be those pillar-like structures, no, holding the transverse process and the lamina. So the general structure of a vertebral bone, we can actually compare this to a house, no, with the roof, spire on its roof, and then we have the foundation and the pillars that will support the roof, no. And the transverse process, you can think of them as like gutters, no, attached at the sides or edges of the roof. So spinous process, transverse process, no, and the other structures here, no, they serve as attachment point for muscles, tendons, and ligaments. So another thing which I forgot to mention a while ago, part of the typical vertebral structure will be articular facets. We have here the superior articular facets of cervical vertebral bone. When we say articular facet, they are surfaces for articulation or surface for forming joints with other structures. No? For the vertebral bones, the superior articular facets and inferior facet, they articulate, no, with, they allow the bone to articulate with the preceding or succeeding vertebral bone, no, in their respective segments. No. You can see the superior articular facet right there, inferior articular facet. So actually, the position these bones are placed right now, no, we are showing them. We are showing the superior view. No? We are viewing the bones from the top. So superior articular facet for lumbar, inferior articular facet. As you can see, depending on which segment they belong, there will be differences no, in the position, orientation of the articular facets or surfaces. So the body is positioned anteriorly. If we are viewing the human body from the side, so we are viewing the thoracic part of the body no, from the side. This will be the position of the vertebra. So this is directed anteriorly, posterior, superior, and inferior. Now let us look at the representative bone from a specific segment and point out uh, peculiarities or what do you call that? The unique features of the bone coming from a particular segment. The spinous process, for example, here, no, you can see it has two protrusions or protuberance at the end. So we describe that as bifid spinous process. And then in the transverse process of cervical vertebral bone, you can see there's a hole or opening in the transverse process. So we call this the transverse foramen. We call that the transverse foramen or transverse foramen transversarium. Foramen transversarium is the Latin form of the name. Transverse foramen is the English name for the opening. So, if there are openings no, in any structure no, in the body, including bones, so we expect structures to pass through those openings. No? And the structure that will mainly pass through the foramen transversum or transverse foramen, the structure mainly passing through the opening would be the vertebral artery. Vertebral artery originates from the subclavian artery, one large artery in the neck, and it will ascend to go up to the head. It will ascend passing through the cervical segment or passing through the neck. And the vertebral artery is one of the main arterial supply or arterial feeders to the circle of Willis. What is the circle of Willis? It is the network of arteries that primarily provides arterial blood to the brain. You can also see the shape of the body there is ovoid. It is wider laterally from side to side than antero-posteriorly. So, next segment, we have the thoracic segment. The spinous process is it's not bifid, no? Unlike the cervical bifid spinous process, and that one that's not bifid, no? There's only a single enlarged end for the spinous process. Now, look at the shape of the body. It's heart shape, no holes in the transverse process. So what structures are unique here, no? Uniquely present? So let's view the bone from the side. You can see at this part of the transverse process, there's a concave part, no, right there. And in this area, junction between the pedicle and the body, you can see articular surfaces. This is articular facet also. So something is attached here. These are called the demi-facets. Demi-facets. Demi, because this is only half of an articular surface. This one as well is half of an articular surface. So when we have another bone resting on top of this one, no, this facet, this demi-facet, no, will form a complete facet, no, together with the demi-facet of the bone on top. No. Same thing with this one. This demi-facet becomes a full articular surface if there's another bone down below. So what structures actually articulate with superior, uh, inferior demi-facet right there, and the articular facets found at the transverse process. So let me I have here we have here two thoracic vertebral bones. No? Let's view them from the sides. When we stack them up, one on top of the other, like this one, so this now becomes a complete facet. No? Let's look at the other side because the demi facet, no, it's not clearly seen in on the other side. No? Okay, there's a demi facet right there. Demifacet of the superiorly positioned thoracic vertebra, and then we have another demifacet which belongs to the vertebra at the bottom. So it forms a complete facet, and what articulates, no, what is attached to that joint surface, no? The head of the ribs, and then right here at the articular facet found in the transverse process would be the joint surface for the rib tubercle. You have articular facet at the rib tubercle right there. So rib is attached to thoracic vertebral bones in that manner. So while we are looking at these bones, these two bones belonging to the same segment, let us point out other structures, no, that are formed when you have the bones stacked up together. So as you can see, there will be an ovoid opening, no, that is formed, no, right there. So let's look at the bones individually first. You can see this arch right below the pedicle of this vertebra. So when you have one thoracic vertebral bone stacked over another, you form what we call intervertebral foramen. The opening that is formed there is intervertebral foramen. So what important structure will pass through the intervertebral foramen? That will be the spinal nerves. So this space in between the bodies of these two bones, the space is not empty. No? That is where you can find the intervertebral disc. Intervertebral disc is a fibrocartilaginous disc found in between the bodies of vertebral bones. This disc, no, allow some movement in between the bones. So when you have those small movements, you sum up all small movements happening in the spine. No? The Those small movements will actually allow us to bend our spine forward, or forward bending is flexion of the spine. Forward bending is flexion of the spine, and then uh, backward arching or bending is extension of the spine. Please take note that there will be also connective tissue structures, no, filling up space between the spinous process. No? Right here, we will be the interspinous, no, ligament. Running right here will be a supraspinous ligament, connective tissue which spans or which connects lamina to lamina. That will be ligamentum flavum. Then we also have important ligaments, no, running right here in front of the vertebral body. No? That's the anterior longitudinal ligament, the wider and stronger ligament, no? Because right here we also have ligament running behind the bodies, no, of the vertebral bones. That will be posterior longitudinal ligament. No? The ligament is limited by the diameter of the spinal canal, so it's the narrower and the weaker ligament compared with the anterior longitudinal ligament, no, found right here. So the strength of anterior versus posterior longitudinal ligament will influence, no, the usual pathology, no, for slip disc. Remember, we have intervertebral disc here. I I hope some of you, or I wish all of you, are familiar with the slip disc injury. What is slip disc injury? No? The disc that is found right here becomes displaced. No? The usual direction of displacement is posteriorly. No? Because, again, the posterior ligament is weaker than the anterior ligament. So direction of displacement is usually posteriorly or posterolaterally. So when the disc right here is pushed backward or posteriorly or posterolaterally, it might compress the spinal cord or the spinal nerves, no, that emerge from the intervertebral foramina or intervertebral foramen. So slip disc injury usually happens, no, when we make it a habit, no, to it's not actually good, no, to always flex or bend your spine forward, especially when you are carrying heavy weight. When you are lifting weights, you're supposed to keep your spine straight so that the distribution or the stress, no, that you subject your spine into will be carried, no, by the stronger and by the stronger bones down below. So for the lumbar vertebra, actually the lumbar vertebral bone, basically it has no special parts, no. All of the parts here are also found, no? But please take note of the size difference, no, in the body, no, the appearance of the spinous process right here. You see, it's wider, no, unlike the narrow spinous process of thoracic vertebral segment. And then we have the sacrum here. We're viewing at the sacrum anteriorly. The sacrum is actually composed of five fused sacral bones. No? The sacrum completes the pelvic ring. This is attached to the pelvic bones, no, completing the ring, no, of the bony pelvis. No. This will be articular surface, no, for the iliac bones. And then you can see the sacrum will have anterior sacral foramina, and structures, no, are transmitted through those foramina. Posteriorly also, we have the posterior sacral foramina. And then we have here the fused coccygeal bones, no? The rudimentary or the non-functional tailbone of humans. This part is called the sacral promontory. It is anatomically and clinically significant, no, when once the sacrum forms part, no, of the pelvic ring or the pelvic girdle. So we have seen and we have discussed the typical bones that belong to different segments. Now let's try to view our atypical bones. When we say atypical, They are not your usual. No? They are unusual bones. So first one here, this is the atlas. Atlas. That's the specific name of this one. The atlas is actually the first cervical vertebral bone. So this is the anterior part right here. You can see it also has your transverse foramen, superior articular surfaces here. Since this is the first cervical vertebral bone, no? What's resting on top of this will be the skull already. No? So you have concave, deeply concave articular surfaces here. That's where the occipital condyles, no, will rest on. Occipital condyles are bony protuberance, part of the occipital bone of the skull. No? The occipital condyles will form the atlanto-occipital joints with these articular surfaces. No? The atlanto-occipital joint allows us to flex our neck, or it allows us to bend our head forward, or to swing our head up. When you bow down your head, you look down, or when you look up, that is part of a neck or a head flexion, extension. When we bow our head down, or swing our head to look up. So, one of the joints functioning there is the atlanto-occipital joint. So sometimes it is called the yes joint. Now, sometimes we call that the yes joint because when we nod our head, no, nodding means you look down, up, no, alternately. So when we nod our head, no, that is one of the way we say yes, no. That body language means we are agreeing to something we hear. So sometimes this is called the yes joint. No? But I guess not for Indians, because the Indian yes, you tilt your head sideways. So the superior articular surfaces or facets have deeper uh, concavity. The inferior articular surface, as you can see right there, it's more flat, no, rather than concave. And Atlas seems to be missing its body. Why? Because that area where the body is missing, no, is occupied by part of the second cervical vertebral bone. No? The second cervical vertebra is called the axis. It's called the axis. No? One prominent unique part of the axis is the dens or the odontoid process right there. It looks like a phallus. It looks like the male sex organ. So why is this bone called the axis? Because it's like the axis, no, for rotation of the head. No, it serves as the axis for head rotation. So the joint formed between atlas and axis is the atlantoaxial joint. If the atlanto-occipital joint is the yes joint for other cultures but not for Indians. The atlanto-axial joint, on the other hand, is the no joint because this allows us to swing our neck looking to the right or to the left. So that particular body language, no, tells us that we don't agree or we are saying no to something that that we hear. There's a transverse foramen in its transverse process right there. You can see the bifid, the spinous process. Another atypical bone that belongs to the cervical segment is C7 or the seventh cervical vertebra. We call this the vertebra prominence. No? Unlike the other cervical bones, it has a long, prominent spinous process which is not bifid. No? This long and prominent spinous process is actually one of the landmarks, no, that we can feel at the back of our neck. If you try to touch the back of your neck, junction between your neck and your trunk, you can feel bony prominence at the back of your neck. That is actually your vertebra prominence. You can see the foramen, the transverse foramen at its transverse process. So here are the atypical bones of the cervical segment again. Let me bring back the thoracic vertebral bone. So this particular thoracic vertebral bone belongs to the middle segments, no? Because it has four demifacets. One, two on that side, three, four on the other side. T1 or the first thoracic vertebral bone will only have not T1. The lower uh, T1 will have complete, no? T1 will have complete facet, the superior part of the body, then demifacet at the bottom. While the lower three thoracic vertebral bones, T10, T11, and T12, they usually have full articular facet for rib heads, no, at the sides because the thoracic bones that belong to the middle segments, they example this bone, no, this vertebral thoracic vertebral bone. Let's say this is T5. No? If this is T5, there will be four ribs, no, attached to this vertebral bone. No? Two on each side. So ribs 5 will be attached to the superior demifacets right there. Let me bring back our ribs as example. One rib will be attached right there. another rib will be attached down here. No? So two on one side, another two on the other side. So the middle thoracic vertebral bones, no, will actually have four ribs, no, attached to them. Two ribs on the same level. So if this is T5, this is rib 5, and then rib 6 down here. No? For T10, T11, and T12, no? The only ribs attached to T10 will be ribs 10. Rib pair 10, one on each side. Same thing with T11 and T12. So that will be our discussion for the bones of the spine. If there are things that were not discussed, no, you're supposed you're supposed to be responsible, no, for reading and whatever is not covered in this discussion but is found in your official textbook, you're supposed to read and know them.